Welcome to Deuk Spine Institute. I'm Dr. Deuk Majin. It's March 11, 2025. Our patient is presenting here with two types of pain, neck pain and lower back pain. Her neck pain is coming from the facet joints in her neck on the left side. She has several joints that are hurting her. Every time she turns her head to the left, it hurts on the left side. When she looks up, it hurts. And it's causing muscle spasms to happen. So we're going to go in and fix those facet joints by getting rid of the pain coming from those joints. So we'll start with the cervical spine. Henry, on the other hand, why don't you show the audience all the different causes of chronic neck pain that people can have? Sean?
Of course.
I'm Dr. Deuk Majin, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. You can see there are about 30 things that commonly cause neck pain, and those things, we call them pain generators. Pain generators. Pain generators are structures in your body that make pain. And it turns out that the most common pain generator for neck pain is actually a damaged disc. Most of you know them as herniated discs or degenerated discs or slip discs. They have different names, but in the end, they're all the same thing, a damaged disc. And those damaged discs can be very, very painful, but they're not all painful, just some of them are. In this patient, her problem is not the discs, her problem is her facet joints. And take a look at the arthritis in the facet joint. Jordan, show us the massive amount of arthritis. You can actually see it. Shot, yeah. All that, right at the tip of my probe. That's where all that arthritis is. It's like beaking out to the side. That's how bad it is. Okay? So, we don't have a cure to get rid of arthritis, but we do have a cure. Can you shorten up the window? We do have a cure to eliminate the pain that comes from the arthritis. Shot? All right. Henry, let's show the audience how we eliminate facet joint pain.
Of course.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from our set of videos that neck pain has more than one cause. Again, the disc is the most common, but not everybody has pain that comes from degenerated discs. This patient, her pain in her neck is coming from her facets. And facets are these little joints to the side of the spine. They get injured, and when they do get injured, they create arthritis. Arthritis is really just your body trying to heal things, fix things, but it doesn't work for these issues. And instead, you get the joint is just destroyed by the arthritis, and more importantly, the arthritis brings pain fibers with it. So, as your body tries to heal, it actually releases cytokines, chemicals locally in the area of the healing. Those chemicals cause changes in your tissues. Specifically, it results in new cells coming in called neutrophils, macrophages, fibroblasts, and endothelial cells, and even nerve cells. And the new nerve cells that grow in with this inflammation, they're very sensitive to pain. And the pain that they're sensitive to is inflammatory pain. It's actually not instability as in your spine's falling apart kind of pain, but it's pain that comes from inflammation. And you guys saw that on our video, is that the facet joints get super inflamed right around where the capsule used to be that held the joint together. And then what happens is the capsule, once it's torn and damaged, it just keeps getting re-injured every time you move your neck and look to the side. So it actually never really heals. And because it never heals, this capsule, your body is just in a state of constantly trying to heal it, but never successfully healing it. And you're in a state of constant, basically warfare, where your inflammatory system is active in that joint capsule, and it's literally trying to get rid of the inflammation, or trying to get rid of the trying to heal the capsule, but it's not able to because you keep re-injuring it every time it gets a little bit of progress. You take one step forward, 2 steps back, if that makes sense. So you start to sew that tear on the capsule back together, and with the inflammatory healing process, and then you turn your head and you re-tear the capsule. So it starts the whole process over. And so you have these areas, it's just literally like a war zone, where you have fighting going on in all these different areas of your spine involving your facets. All right, just about done on the left side with the neck. Any questions?
Yes, we have a question coming from Ping on Facebook.
Hi, Ping.
Saying, hi, Doc. Can someone who works at height look vertically up after and down after the cervical DLDR?
Yes. The cervical DLDR is perfect for people who need to use their neck because we're not fusing. We're not taking movement away, we're actually giving you movement back. See, the thing is, most patients with pain in their neck, they don't have a physical loss of movement, they have a functional loss of movement. The difference is physical means you had a fusion done, or you have metal in there holding things together, keeping them from moving. Whereas functional means that you are in pain, so functionally you're not moving because it hurts to move. So you're stopping yourself from moving versus something structural stopping you from moving, like a fusion. And there's a difference there. Shot? All right, I'm trying to head down lower, not laterally. I'm just trying to get the last few facets at the bottom here. Any other questions?
At this moment, no current questions.
And by the way, she has one of the worst cases of arthritis I've ever seen. It's severe. And I don't mean her symptoms. I've had people with equally severe symptoms. I'm talking about structurally. If you look at her spine, the amount of arthritis is literally, on a scale of 1 to 10, it's a 10. It's so severe. All right, almost done. I just have to get down to the bottom facets. I'm trying to do it with one incision. Hopefully I can do that for her. If not, I'll have to make a second incision a little bit lower. She has a long neck. Shot. All right, getting there. Why is this room getting warmer? But why would we make it warm? Shot. All right, any other questions? Did somebody raise the temperature?
Yep.
Huh?
No. I mean, they're gonna fix it right now. I don't know if it's actually that or because they're dealing with the power. I don't know if actually the chiller is actually working. Yeah.
And it's 71? That's what I'm worried about. I don't think anybody would change it. Well, that's why I'm asking if anybody touched it. Shot. All right.
No current questions, but we do have a comment coming from John on YouTube
Hi, John.
saying, hello, Dr. Deuk. John here from New Jersey.
Hey, John from New Jersey. How are you? So, everybody, we're done, but we want to show you the trailer for our new movie that's being released. It's an expose on some of the bad things happening today in spine and the corruption of the companies that manufacture the implants that go into people's spines, the devices. The first movie is called Spine Scam. It's the first movie in a series of movies that hopefully will be picked up by a streamer. And we're going to be doing our, We're going to be doing our, no, I want to do it now before we forget. We're going to be doing our screening this Sunday, Eastern Standard Time, 4 p.m. And it's free for you all to watch the screen. I hope you do. And Henry is going to show you the trailer right now, and we're going to end this stream with the trailer. But look at the links. You can see a link to watch the preview this Sunday, which is going to be March 15th?
16th.
16th, I apologize. This Sunday, March 16th, 2025, our first preview of the movie, Spine Scam.
Allegations have surfaced pointing to a major bribery scheme between medical providers and spinal surgeons. What we uncovered is potentially criminal.
This consulting package is worth $300,000 to $500,000 a year.
You know how this works. You lie to people in pain to make a buck. And I give you tropical vacations and pleasure cruises to make it worth your while.
Your fusion technique is looking very good. You stay focused and disciplined, you'll go a long way in this business.
And I'd like to thank my friends Bruce and Rhett at Globazon for helping to develop these exceptional products.
I wonder how much that fucker makes from those implant companies.
You think he's on the take?
You know he is.
We need every one of our residents to be loyal to the program and loyal to the Globazon brand.
There's a new aspiring neuro at SD University Hospital. I want you to move in and land him.
And how far do you want me to go?
Whatever it takes.
You have lumbar degenerative disc disease. Spinal fusion is the only option.
Lately, I've noticed the hospital seems to be doing way too many surgeries. Like we're doing it just for the money, not because it's 100% the right call for the patient.
Your little prodigy's become obsessed with some sort of alternative laser treatment.
It's better for the patients.
For your own fucking good, drop it.
I feel like they're all pushing me to do what's best for them, not necessarily what's best for me.
Why can't anyone just do the right thing?
We do not need some morally virtuous renegade poking around.
This could become a complete shit show.
What about our pledge to the industry? What about the welfare of our patients? What about our own moral code?
And if he doesn't listen, then cut him loose.
Hey, remember when that douchebag Dr. Bob used to be an idealist? Now he's just a capitalist.
Capitalists like money.
Yes, they do.
Welcome back, Sean. We are performing our Facet treatment in the lower back. This young lady has both cervical and lumbar facet problems. And so I'm treating the facets in her lower back at this time. Did you enjoy the trailer? I hope you did. We're looking forward to the movie launching and being streamed. So on one of our streamers, like Netflix or HBO. Any comments or questions?
Yes, this next question is coming from John once more on YouTube, saying, I'm having muscle spasms in my left calf. What can I take OTC for relief until I get the piriformis procedure?
That's a great question, my friend. I don't really deal with medications, but you can try a Voltaren patch. I've had some patients tell me the Voltaren patch works really, really well, and you have to probably put it on your buttock. That's what I would recommend. Try it on your buttock. Voltaren, Voltaren patch. Sean? All right, she has bad scoliosis, so I'm trying to get myself over there to that location. What'd you find out?
I lowered it. It said 64, so I don't understand why.
Is it working?
So why don't we
All right, any other questions?
Yes, this question coming from Charlie on YouTube.
Sure.
Asking question, when you perform a piriformis release, what determined the location of your cut? Proximity, or is it the origin better than the insertion?
Yeah. So first of all, I never would cut the origin of the piriformis. It's too dangerous for the patient. The origin is on the sacrum, and you can get into a lot of trouble if you try to cut it off the origin. It's very ill-advised. I would never do that. The insertion, which is on the greater trochanter, is our target. And so it's not easy what I do. I don't really give away all my secrets, but there's some things you have to do to really make sure that you do it right. And that includes positioning of the patient, Sean. And if you want to learn how to do it, you'll have to come to Deuk Spine and have me train you. All right? Sean? All right, let's see here. This is it. She's very difficult. Very difficult for me because her anatomy is so abnormal. She has a lot of going on, a lot. Namely, Sean, she's got some osteopenia, so some soft bone, but she also has a twisted spine with severe arthritis, and the arthritis is actually, Sean, the arthritis is basically blocking me from getting to where I need to go. Sean? And it's very unusual, the amount of arthritis she has. Most people have arthritis, but hers is profound. Almost done, but not quite. I need to get this last one.
No current questions, but we do have a comment coming from Janet on Facebook saying, thank you for making the movie so everyone will know what is happening.
Yeah, you're welcome, Janet. I agree. People need to know the truth. I'm shocked at my colleagues. I'm ashamed at what's happened in the industry. And patients are unfortunately being lied to and taken advantage of, and their health is at risk, which is the most important thing we have, is our health. And it's costing our system billions of dollars. Billions of dollars. Actually, my estimate is around anywhere between 250 to 500 billion a year in waste, fraud, and abuse. To steal some descriptions from Deuk: waste, fraud, and abuse. We have a lot of it in medicine, and it's all basically perpetrated by doctors, hospitals, and companies manufacturing these implants that go into your body, totally unnecessary, most of them, and they cause harm to the patient. And that's the problem. So people need to know the truth, because nobody else is going to tell you. No one else wants the truth getting out. Any other questions?
No current questions. There's a comment from Ping once more on Facebook saying, looking forward to seeing the movie also.
Thank you so much. Enjoy your day.